In this position, I cover about 20 to 30 meetings a year. I'm usually where you are. So I'm speaking as an authority, which also makes me a little bit more uncomfortable. Because my job, as a journalist, my job is to bear witness and to inform. So I'm not here as an advocate. I also want to make a disclaimer that I won't read this right now. Disclaimer that I am not speaking for any organization. I just speak for myself. Last month, the American Academy of Pediatrics, prestigious journal, Pediatrics, published an article. It was April 4th. It's titled, "Child Fatalities from Religion-Motivated Medical Neglect." The authors were Dr. Seth Asser, a pediatrician in San Antonio, although I believe he's also part of the Department of Pediatrics at the University of California, San Diego School of Medicine, and Rita Swan, who is the president and founder of Child Inc., which stands for Children's Healthcare is a Legal Duty, based in Sioux City, Iowa. The article found, what the article did was it looked at all cases that Child Inc. had gathered of children who died of medical neglect due to religious practice. All fatalities that they could find. They had 172 cases in their records who died, boys and girls who died between 1975 and 1995 over the 20-year period. They looked at the medical the records, and it's best that they could gather, or say, the postmortem records. And based on the study, they found that 140 of the 172 fatalities were from conditions that no child should ever die of. They're just not in this age, only in the third world country, only the impoverished in the third world country will die of these diseases. Well, I should not exaggerate that a bit. The criteria was expectation of survival was above 90%. 140 of the 172 cases. 18 had an expected survival rate of over 50%. And all but 3 of the 172 would have benefited from clinical help, such in terms of relief of extreme suffering and pain. They came to the conclusion that when faith healing is used to the exclusion of medical treatment, the number of preventable child fatalities and the associated suffering are substantial and warrant public concern. And then they also say that existing laws may be inadequate to protect children from this form of medical neglect. Obviously, this is not a double-blinded controlled study. Such gold standards for scientific medical studies are basically not allowed by the promoters, those who practice faith healing to the exclusion of medicine. They don't want to put their claims to controlled tests. So this is obviously not a study that has the strength of a randomized controlled trial. But it's unique. It's the first of its kind that was looked at a group of dead children who died from the withholding of medical care, and looked at the medical evidence and the medical records of what other children with similar diseases and disorders had, their survival rate. No child should die of appendicitis in the United States. If a child dies of appendicitis, it's criminal, whether or not the prosecutor in that jurisdiction recognizes it as such. No child should die of diabetes. It's criminal if a child dies of diabetes. And yet children are dying several each year because parents withhold insulin. In some cases, throw away the child's insulin because some religious leader says the child is healed. doesn't need insulin anymore. I first met Rita Swan. Well, let me say, I got into covering this area in 1983 when, let's reverse that. Rita Swan founded Child Inc. in 1983, which was the year I met her and got involved with covering this area because she was at a conference speaking. She and her husband, Doug Swan, lost a child, about an 18-month-old boy named Matthew, in 1977. The boy died of bacterial meningitis, untreated with medicine. Adequately treated in time, 90% or more children will survive. Untreated, it's virtually a death sentence. And Matthew died. And that drove the Swans out of the church. They were lifelong Christian Scientists. So they abandoned the church and did a lot of soul searching and got very angry about how they had been manipulated and confused and made ignorant and fearful of the evidence and the knowledge that could have saved their boy. So she started Child Inc. 83. And that's when I first wrote about this area, because some of you may remember back in the early 80s, a child had been born severely deformed with severe birth defects, and was the physicians in the hospital did nothing to keep the child alive and prolong it, and it created a furor. It was called baby doe. The whole issue, in fact, the legislation that came out of it was referred to as baby doe, disguising the child's name, the family's name. But what happened, there was the Right to Life, there was a huge effort to pass a federal law that said every child born, whether they have a brain, no matter how viable the child is, they must have medical care. You can't abandon a critically ill baby. A type of very, very severe birth defect, anencephaly, it's one of the neurotube defects. It's spina bifida when there's an opening spine down here, but if there's an opening here and the brain does not form, it is not consistent with life. The child has basically no cognitive function and dies. Well, even children born with anencephaly, this legislation would impose doing everything you can to keep the baby alive. And if you don't, then it required reporting. Anyone calls this toll-free secret number and says, this hospital has an anesthetic child and isn't doing anything, doesn't have any life support, prolonging the suffering, well, then the feds send in this SWAT team to take over the hospital. Okay. The Christian Scientists got very worried about this because they, as part of the tenet, they do not provide medical care for critically ill children. They provide their form of religious prayer. So they got Orrin Hatch to propose an amendment. And if I can translate the legalese, it was basically, it would change the proposed federal legislation to any child born with any kind of birth defect must receive maximum medical care, except that they're born with the defect of having parents who are Christian Scientists. Then they can receive medical neglect and die of them. For instance, one common, not uncommon, I should say, birth defect is a diaphragmatic hernia. The diaphragm, it doesn't form, and the intestines protrude into the chest cavity. It prevents the proper formation of the lungs and all. Well, that's very lethal in a newborn. It can be surgically treated. Left untreated, almost certainly the child will die. So here we would have this new legislation that would really get involved and impose the federal government into the hospitals between the doctors and the patient's newborn, and force them to provide hopeless care on everyone else, but on the Christian Science children born with repairable disorders and malformations, it would be hands off. Well, I wrote about this for Medical World News and got a lot of attention. Enough heat was put on Orrin Hatch that the church asked, actually, well, it was put on the church and Orrin Hatch, and Orrin Hatch quietly withdrew the proposed amendment. That's what drew me and got me interested in this back in '83. How the federal government, I'll only go back to 1967. A Christian scientist by the name of Dorothy Sheridan was charged and convicted of manslaughter in the death of her 5-year-old daughter in Massachusetts. The girl had pneumonia, and she was not treated in any way except with prayer, Christian Science prayer. She was found guilty of manslaughter, and it was a very, very widely discussed case, and got a lot of media attention, and the Christian Science Church got very upset about that. And they launched a lobbying effort to get the federal government to require states to add exemptions on their child abuse and neglect statutes, civil and criminal, that would exempt anybody from killing a child through medical neglect if they do it for religious reasons, providing, of course, that it's a religion, and then, they fill in various words to describe the Christian Science Church. In most cases, not mentioning it, but some statutes actually specify that that the religion would be Christian Science. Never mind the First Amendment that prohibits the recognition of the official recognition of any denomination or religion. So the states were then confronted with this threat from the federal government: you're not going to get federal dollars, Medicare, Medicaid, unless you adopt these legislation, these laws protecting parents who withhold medical care from children for religious reasons. Now, it's been like World War I, trench warfare, back and forth. But right now, I checked with Rita Swan, 41 states have civil exemptions on civil statutes, and 31 have criminal exemptions on criminal statutes that will protect parents from prosecution. The only states that have none out of the 50 is 4: Massachusetts, North Carolina, Nebraska, and Hawaii. I didn't think to ask her what happened to South Carolina. South Dakota. South Dakota was one. Apparently they're not. I suspect that after winning in South Dakota, getting it repealed, the church went back in, the lobbyists, and got the legislature to put it back. It's like World War I trench warfare. I'll give you another example. In 1954, California required the TB testing of all teachers, public school teachers. I think even private school teachers. I'm not certain of that. But all public school teachers in California had to be tested for TB, so they're not going to expose the children. Except, if they were Christian scientists, they did not have to be tested. They can sign an affidavit that they're okay. And Cora Sutherland died of TB. She exposed hundreds of children to TB. And the public was so outraged, they repealed that law. Well, guess what? California put it back in again. I talked to some of the people there in California, and I think in the Board of Education, and basically they explained to me that if they have reason to think that the teacher has TB, they can order an X-ray. And I asked, how? The purpose of TB testing, with the skin testing, is to catch those that are not obviously TB. How many teachers come in with a cough from a cold? It's absolutely crazy. but it says that the teacher, him or herself, can decide whether they're healthy. But what do Christian Science children and what Christian Scientists learn about illness and disease? Well, they're basically taught that teaching anything about disease causes illness. Okay, so you don't want to be ill, don't learn anything about disease and illness. In many states, I forget the number, children are exempted from hygiene and health classes. They can get out. They don't have to learn about TB and HIV, sexually transmitted diseases. They're not taught about not dripping the raw chicken meat on the cutting board and not, watching out for the salmonella. They are exempt. They don't have to learn that. So here we have the teachers who then are supposed to identify when they have TB, when you and I, who learn about illness and disease, can't tell if we have TB without a test. In many states, I forget the number, they have laws exempting Christian Science children, and also, in some states it's really it's written so it means Christian Science children, or in other states it has exemption for all religious reasons, that children can be exempted from immunization requirements. In many states, to go into public school, to enter public school, you have to produce evidence of immunization. Christian Science children are exempted, and other faith-healing sects that shun medicine are exempted in these states. So where do we find measles epidemics? Where do we find polio? Where do we find rubella, congenital rubella? We find it primarily among these religious sects. 1972, in Connecticut, a Christian Science school had an outbreak of polio. 11 children developed paralysis. The school never reported to the authorities that there was this epidemic. They say that the church constantly says, well, we report what was required. Well, polio was required by law to be reported. They claim they report illnesses as required by the law. This epidemic is reported by outsiders who noticed it. Then the state had the power of the law to go in and immunize the remaining children. I just learned that the Christian Science has another legislative campaign. They're trying to get legislation that will exempt their children from blood lead level testing right now. They say that this is essential for their practice of religion, and I do not understand why they need to exempt testing of lead of their children so they can practice their religion. I don't understand that. I've talked to them, I've interviewed them, I've written about them. I have yet to grasp, get an understanding of this. In England, in the United Kingdom and Canada, Christian scientists practice Christian Science. They are not exempt, they're not exempted from protecting their children. They claim, though, the church, the spokespeople have told me, that can't be done here. It is essential that we exempt children from Christian Science, children from medical treatment, for us to practice religion. And yet they practice their religion in Great Britain and in Canada. They have not explained to me the difference. I think I know the difference. The people of Canada and the people of the United Kingdom will not tolerate the death of children from diseases that have no reason to be killing children. Let me put a face on some of these. These are statistics, and I made some pretty bad overhead transparencies, I might add. Can we do something with the lights, like turn them down? Oh, I know how to do this one. This woman, I don't recall her name. The child, though, this is a press conference. Ashley King was a 12-year-old girl who developed a sarcoma, and her mother, a Christian Scientist, pulled her out of school. I think she was out for 7 months or something like that. See, this is what happens when a child develops a serious illness often in Christian Science. Christian Scientists are they're mainstream Americans. They're in Congress. They're your lawyers. They're your teachers. They're all of it. It's not like some crazy separatist cult in Montana hidden away with their own burial yard for children. They're mainstream. So when a child becomes critically ill, they're pulled out of school. That prevents the reporting to the authorities of a severe illness in a child. So they usually keep them home. When the neighbors finally, oh, by the way, the school knew this girl was very sick and did nothing. They provided at-home instruction material. By the time the neighbors called the authorities, the tumor on our leg was 41 inches in circumference. The state then intervened, but there was nothing to be done as far as cure. So they did nothing. Ashley King was put in a Christian Science sanitarium, their nursing home, and where she died with no relief from pain other than being reminded that the other residents in the nursing home were being disturbed by her cries.